Hello, my name is Trenton Allen, and I am here today to talk to you about the importance of stem cells in medicine. So, what are stem cells? Stem cells are cells that can differentiate into any type of cell based on their environment and stimulus provided. Um, Below are some types of stem cells that are important to know. So, embryonic stem cells are the cells that you typically think of when you're thinking about this topic. They're the cells that come from when a sperm and an egg come together to form an embryo, and they create an embryo which is then killed and then used for research, which comes with many ethical and religious um, problems, as well as there are another type is MSCs, mesenchymal stem cells. MSCs are adult stem cells. Uh, these are cells that are found in the body, as you'll see soon enough, and are used, and all adults have, and can be used to heal. As well, there are iPSCs, induced pluripotent stem cells. These are cells that anyone has been injected with an infection that then reverts that cell back to an embryonic state, which allows us to research similar to embryonic stem cells without having the ethical or political or religious controversy surrounding embryonic stem cells. So here are some examples of what MSCs can do. They can turn into fat, cartilage, bone, stroma, and other things. As well, they have anti-inflammatory and immunomodulation properties. And they can come from bone marrow, the umbilical cord, muscles, and can be used for many things. Whereas iPSCs can be used to form any cell in the human body, given the right stimulus and environment. Stem cells in the optic world have been used to repair eye damage such as glaucoma, diabetic retinopathy, and age-related macular degeneration. The eye offers a great place to study stem cells because not only is it visible easily, you can see it and you can watch when things are happening in it very easily. It is also easy to inject stem cells where they need to go because you don't have to do any like crazy surgery or open up a part of the body. It's right there. You just inject, and it's easy to get to. Because the mammalian retina does not regenerate on its own, it can be extremely useful to use stem cells in order to regenerate your retina or any other area of the eye, because it would not normally regenerate on your own, which is why as we go on through life, everyone's eyes are constantly just getting worse. They never get better. So stem cells can help in stopping that and even fixing parts of the eye that are damaged, providing an increase in vision as opposed to a loss. And can even make it so that you wouldn't have to wear contacts or glasses, kind of like LASIK. Similarly, spinal cord injuries, or SCIs, over 27 million people around the world are living with an SCI, and 90% of them are from traumatic injury. So, stem cells have been used in this area to help in repairing the spinal cord by regenerating those axons and neurons in the spine to help aid people who are like paralyzed from the injury down. So, although no human trials have been done with iPSCs, animal trials as of right now are showing a really promising outcome and have been found to successfully treat spinal cord injuries in animals. As well, 29 291,000 people in the US alone are affected by this. So it would be a major medical advancement if we could figure out how to use stem cells to regenerate spinal cord injuries and get everyone back out there and living life like they were young again. And then there's cerebral palsy. So cerebral palsy is a lifelong disability in children, which comes with many problems like epilepsy, disturbances of sensation, perception, and more. Cerebral palsy is a completely life-changing event when you have and it not only affects the patient, but also the parents of and any family around someone with cerebral palsy. It is quite a disability. Um, However, there is hope. Stem cells have shown to help a 6-year-old Chinese girl who received 16 intravenous injections of stem cells and experienced an almost full recovery over a 5-year period. Now, they did relapse, and that is because they stopped, the clinical trial had ended and they stopped receiving injections. However, it is completely possible, based on this research, that someone with cerebral palsy could actually experience a completely normal life if a regular dosage and amount of injections was discovered that could um, help not only put them back to normal, but keep them normal uh, as well and keep them recovered. Uh, this could be a life-changing, this would be a life-changing discovery if cerebral palsy could be cured by setting up regular injections of stem cells to um, help them recover and be like the rest of us. That's horrible wording. Um, However, there are limitations to stem cells. In the optical field, there's something called the switchboard dilemma, which is basically even though we can regenerate the connection between the eye and the brain, we don't actually know the connection where the connections go exactly. So it would be extremely dangerous to research this in humans as of right now. However, basically, if we connected them willy-nilly, your vision could end up upside down, or you could see things coming from the right that are actually coming from the left. And it would really, it would be traumatic for the patient being researched, and probably for the scientists as well, um, if they messed around with that really in humans first. So the not all blindness can be cured by stem cells, but it's definitely possible that but it is definitely shown that eye damage can be um, repaired. However, not complete blindness. As well, the problem with stem cells is that they come with tumor regeneration, tumor generation, sorry. Um, so they can create tumors and whatnot because they have high proliferation. However, that is already solved by cancer treatments like tumor suppressors and asecretase inhibitors and quality checks. So tumors aren't really the biggest problem we have here with stem cells. It's knowing how to use them to make the right connections to actually fix the issue. And then as well as that, much like blood, there would have to be a storage, a sort of cell bank, if you will, of cells that could be turned into any type of embryonic stem cell needed for a type of recovery. So much like blood, people would have to donate cells, and they would have to be collected and stored properly and distributed much like blood is in order to repair people with those injuries around the world. And finally, the ethics issue. So, where are we getting these stem cells? As mentioned before, adult stem cells and induced pluripotent stem cells, perfectly fine. They come with no ethical or religious issues. Um, and this table actually here is what the Middle East has taken up in their research of stem cells and what they think is ethically okay. Uh, they have a very strict religion uh, when it comes to babies and early life and fetuses, much like Christianity here in the States. So it is easy to make this less of a political and religious and ethical problem if we follow a similar model. So they're okay with using adult stem cells, iPSCs, MSCs, umbilical cord blood, which is a source of embryonic cells, placenta, aborted fetuses for therapeutic reasons, such as like if the baby would kill the mother or something like that, as well as spontaneously miscarried fetuses less than 120 days old. As well, however, they are not okay with using fetuses aborted for a non-therapeutic indication or spontaneously miscarried fetuses more than 120 days old. I feel like this is a pretty reasonable model to follow, since most cultures do not use the umbilical cord or placenta, and they end up being thrown out or wasted. And by following this model and doing more research on stem cells, it is possible to create a cure for cerebral palsy, reverse eye damage, cure spinal cord injuries, and even more in the medical field, all without losing a single embryo.